Welcome back to CAC in the morning. As I had promised earlier on, is that we will be looking at issues to do with infertility, that is in both men and women. And we definitely have an expert with us, Faith. You're welcome. Thank you so much for creating time to come in for the show. I'll just give you an opportunity to introduce yourself.
Yeah. Wow. Good morning, Sheila.
Good morning.
Thank you so much for inviting me to this platform so that at least I can be in a position to educate the media about infertility. Yeah, well, my name is Faith Kemuto. I work in one of the top leading fertility clinics in Nairobi, whereby we do IVF and IUI and all matters pertaining fertility. Glad to be here.
Thank you so much. So, for starters, let us just look at infertility. I know that it's quite a broad area to look at, but within the 1 hour that we have, we'll just try as much as possible to make sure that we are educating you, our viewer. And just to let you know, before we start our conversation, is that we are also coming to you live. That is on Facebook as well as YouTube. That is CAC TV Kenya. On Twitter, you can just get into the conversation and just share in your opinions as well as views. If you have any question, that is CAC TV _Kenya and Ida _Munzati. So Faith, let's just start by looking at the numbers as far as infertility is concerned. How many people are affected and how does the number look like?
Okay, well, before I go to that question, I'd want us to understand what infertility is. So basically, infertility has been classified as the 5th globally from the World Health Organization's statistics. Infertility has been classified as the 5th topmost disability. So, well, infertility, this is how we define infertility. It is infertility can be defined as the disability to become pregnant, or rather to naturally conceive. And this one is always attained after a couple has stayed together. They are having intercourse without any protection for a period of 1 year without getting any product, or rather without getting a child. So this one can be caused by age, especially for us ladies. So when a lady is beyond 35 years of age, now we reduce the number of months to 6 months. They have stayed with the partner, or for 6 months at 35 of age, and you are not able to conceive naturally. That is when you're supposed to come and visit a gynecologist or a fertility expert to determine what could be the cause of that. Yeah, so globally, not even globally, in Kenya, the current statistics that we have for infertility cases is between 15 to 20% for both male and female infertility. So if you take a closer look at it, conservatively, in the Kenyan nation, we are about 50 million beings. So basically that means 15 to 20%, let's work with 15%. So basically that is 7.5 million Kenyans suffering from infertility. If we look at it more closely, for you to have a rough idea or a figurative count for the 7.5 million, in Nairobi alone, we are around 4 million. If we could take, the neighboring counties like Kiambu County, put a little bit of Kajiado area, and put a little bit of Nakuru, lock it in. You can imagine all those individuals having that disability, that is infertility. So you can imagine how it has taken a toll over us and the stigma that is associated with it. So it's something that we really need to discuss about and see how best we can manage.
All right, so just from your numbers, it's quite let me put it as an issue or a problem in the society, just as you put it. Just taking the Nairobi metropolitan area, there's quite a number of people already affected. And just you've mentioned of what infertility is, and just to make it clear that if I'm below the age of 35 years, so I'll say that I'm infertile. That is if I'm not able to conceive within 6 months or 1
below the age of 35 years, it's within a period of 1 year, having intercourse without any contraceptive, that is when you're supposed to get worried. And I'll explain later the reason as to why this differs with the age, especially for us ladies. Yeah.
All right. And now let us just try and see how exactly probably a conception or the making of a baby happens, probably what could be the problem. That is, you've mentioned age as a factor, but what could be the problem? Let us just start with women first. What could be the problem, or what are the causes?
Okay, awesome. Yeah. Ladies first. Before I go to that, I would like to tell you that we have two types of infertility. That is primary infertility and secondary infertility. Primary infertility is whereby the couple has never had any kids. For secondary infertility is whereby a couple had babies before, but they have stayed for another time, like 2 years, 3 years. They are yet to get to their second baby or third babies, but they cannot do it naturally. So then we have causes of infertility, and for ladies, I'll start with ladies, definitely. And our number one, as I mentioned about the age, you know, as ladies, age is a big factor because when you are born, when a girl is born, they're born with all their complete set of eggs, as opposed to our counterparts who are men, who after every 3 months, they produce new, sperms, these, new production. So for us ladies, as you grow, you see, naturally, puberty starts at around 12 years, up until, menopause. So then look at a girl who was born with around, in every menstrual time period, we shed eggs. So when you shed, it means the quantity is going low, and the quality as you age also goes down. So then by the time you get to 35 years, let's imagine, let's just take a conservative number of like you started your menses when you are 12 years old. Now you're at the age of 35. You're shedding off, your periods on a monthly basis. So 35 years minus 12 months. So basically, those are how many? 23 years that you've been losing an egg on each month, on each year. So for 23 years times 12 eggs on a monthly basis. So that is basically 180 eggs there. 200, you can do the math for me. Yeah, so well, or the viewers can do the math. So you find out that as we age, the eggs reduce, the quantity of eggs reduce, and the quality also goes lower. So by the time you're 35 years old, your egg is not, of good quality. So that is the reason as to why we say that in 6 months, when you try to conceive and there is failure, then you need to visit us. Okay. Age being number one. Another reason that is broadly known is the uterine fibroids. Uterine fibroids are growths that grow within the endometrium. The endometrium is I'll give an example, like you see in this hall where we are inside. So I'm trying to give an example of how the endometrium looks like in the uterus. Within this hall is what we call an endometrium, where the baby attaches itself. Outside the hall is a myometrium outside. So you find these uterine fibroids, they implant themselves inside here. So that restricts the sperm from, attaching to the egg in the right way. So then it becomes very difficult for natural conception to occur. All right, so we are looking at fibroids, the issues to do with age as well. Any other factor? Yes, we have other things called the endometriosis. That is also a disorder. As I told you, the inside of the womb, that is what we call the endometrium. Now the endometrium being aligning, it reaches a point whereby the endometrium can cramp itself. It's not so straight the way, the lining is not so well aligned within the uterus, and so you find it cramping. That is when you find out that you come up with that condition called endometriosis, whereby this endometriosis, this is how the symptoms come in. You find out a lady having very heavy periods, abdominal cramps, whereby you even find them crawling. That is a first sign for you to see that you have endometriosis. So when you have endometriosis, it's very also difficult for you to conceive. We also have other factors like PCOS. PCOS is what we call polycystic ovarian syndrome, whereby cysts also grow within that. We have social issues like drinking, smoking, and you know, nowadays we say that we've empowered a woman. The girl child is well empowered, and so what a man can do, a girl can do better. So our girls or our ladies have decided to go out on that social, you know, platform, and they decide to drink themselves, not knowing that that one can actually affecting their infertility, because drinking too much can affect the functions of other body organs, like, you know, the liver, even the way you reason. And now when other organs are not well, you know, functioning, it trips down to the reproductive health system. And so you find yourself having trouble conceiving naturally. Yeah.
Okay. Now, before we go to, let me just talk of the reasons that you've given. Now, for the external factors, you've mentioned over smoking, alcohol as well. Does this apply to men as well, even as you bring in now the other factors or causes of infertility in men?
Yeah, it does. As I said, we categorize the drinking part, alcoholism, drug abuse, mirror, and, you know, such like drug abuse, drugs that are abused. They affect the body's functions. So then they also affect the processing of their, you know, sperms, and then limiting the chances of natural conception. Yeah.
All right. Now to the other causes.
Yeah.
That is of infertility in men.
Yeah, well, now to men, age is not a factor, but that is why you actually find out that a 70-year-old man can, you know, go ahead and impregnate even a 20-something-year-old lady, because then they do a production of the sperms after every 3 months. Yeah, so for the men, we have blocked tubes. So this condition of blocked tubes is called varicocele, whereby within their testicles, we have the vas deferens. We have a certain organ called the vas deferens, whereby you find out that it has been blocked. Most probably, when this boy was being, you know, born, the mother or the caregiver was not, you know, checking out on the testicles how they were. So as they grow, you find out that the tubes block, the testicles as well become undescended, and that is a condition we call descended testicles. And you know, when the testicles are, you know, in that pattern, there is failure for the sperms now to walk through, so that they can be able to impregnate a woman. Another big factor that affects men is a condition we call azoospermia. Azoospermia is a condition whereby, the man completely doesn't have any sperms. Or they have a low sperm count. Yeah, so in such a condition, mostly, you know, the man can be able to ejaculate, they can have an orgasm, but when it comes to the sperms, the fluid content, it only has the semen, but it does not have the sperm. And we both know that it's the sperm that has to reach the egg for fertilization to take place. Yeah, so that is it for the men. Yeah.
Okay, now for men, you've mentioned of tubal blockage.
Yeah.
Does this also happen to women?
Yes, it does. Actually, 80% of the patients that visit our hospital, for the ladies, it's always a condition of blocked tubes. And these blocked tubes, as I told you, take an example of my arms being, you know, the tubes, and, you know, the ovaries hanging down here. So once the tubes are blocked, it's just obvious that conception cannot take place, because the sperms cannot move through to the egg, so that fertilization can take place. But in such a scenario whereby we have blocked tubes for a woman, we always send them to have an imaging or rather an x-ray to be done for them, because that is not what you can do like a physical examination. They have to undergo an imaging whereby they do a test called HSG. That test is the one that will actually determine the tubal blockage. Yeah.
Right, now talking of let me say you've talked of a sperm count for men. Does it mean that probably if a man does not have the right number of sperms for fertilization to occur, are we looking at the reduction in number in terms of the speed to which now the sperm reaches the egg, or how exactly? Probably just explaining it in a layman's language.
Okay, well, thanks Aida for that question. Yeah, well, about the sperm, we always look at so many categories within a sperm. So basically, there is a test that we call semen analysis. In this semen analysis, we only extract that content through masturbation. Apparently, our Africans, or rather our Kenyan men, it's something that they wouldn't even think of doing it. But anyway, they have to do it for us to test. So then the content of that ejaculate, in 1 milliliter content, we are supposed to have 20 million sperms. So a man can ejaculate up to 3 milliliters of that content of the ejaculate. And if 1 milliliter has to account for 20 million, so for these 3 milliliters, we are looking at 60 million viable sperms. When you're looking at that is the content now. So for the sperm again, we look at the morphology. The morphology of the sperm, how it looks like. The sperm normally has a head, it has a neck, and it has a tail. So we are supposed to look at it. How is the morphology? How does it look? Can this head be in a position to swim up until it reaches to the egg? How is the tail? Is it able to attach itself to the, you see? So if the morphology is not as it is supposed to be scientifically, then it means these sperms cannot be in a position to fertilize the egg. Number 2 thing that we look on this sperm, we look at the motility. How do they swim? How fast do they swim? So if the sperm swims so slow, basically they'll not be in a position to fertilize the egg, or to reach the egg at the right time, right? So then there are some supplements that men are given to boost such scenarios, or better still, if you find out that this it's just an ejaculate without even the sperms completely, we have a surgical procedure that we even go ahead to do, so that you can be in a position even to extract only 1 sperm. And the surgical procedure is called testicular sperm aspiration.
All right.
Yes.
So it's not just the issue of you producing sperms, it's also probably just the components or how your sperm looks like for fertilization to occur.
Exactly, yeah. Yes.
Now you've mentioned of masturbation. Before we just get to the next question, a number of men would ask, and numerous of them have actually reached out to me via social media just to ask, does masturbation lead to infertility? Okay,
well, I would say no, scientifically it's not yet proven, because once you masturbate, you're basically, it's a psychological thing. I'll say it does not lead to infertility, but it has other psychological factors that you'd be affected with. Yes.
Okay. Now, just when we started the interview, you talked of, let me just put it as a stigma that is probably just associated with infertility. And you've mentioned that it's both a man's issue and a women's issue. So why is it that probably, let me say, in a relationship or in marriage, when there is the issue of infertility, it's the woman that is pinpointed and not the man? Is it that probably the chances of a woman being infertile is high compared to men?
Awesome question. Yeah, well, I would want to give out, to explain to you that question as I pinpoint the current statistics of the factors now, not the general statistics of infertility. As I said, infertility is caused by both male and female factors. Apparently, 45% causes of infertility are due to male factors. 35 are factors. There's a remaining 15%, 10%, 30%, sorry, whereby 15% are other factors, and a very slim, which is 5%, we call unexplained factors. Unexplained factors. So then, when we look at infertility, most, you know, in our African, I would call it like infertility is like an infertility belt. It's a belt from the sub-Saharan countries, European countries, up to the African. You know, us women are the ones who carry the evidence of pregnancy. The only, you know, thing that can tell you, like, you know, this couple is infertile, it's because the lady can not carry the pregnancy. There is no way you can tell a man is, you know, has an infertility issue, yet they're just, you know, walking around. They can actually even, you know, have intercourse normally, ejaculate, you know, have any fluid coming out, but there is no way you can physically diagnose that, you know, a man has any infertility issues. So then that is why our culturally, a woman is the one who's, you know, normally pinpointed as infertile person. I'll give you something, maybe maybe a scenario. I've seen a couple come to our center. Once this couple comes to our center, the man states that this is the second marriage to the man. So the man states that in his previous marriage, he had kids. Here is the second marriage. So in this second marriage, he comes in, they have stayed probably for 5, you know, 6 years or even 2 years, whatever. But in this scenario, they had stayed for 2 years without getting a child. So everybody else is pinpointing to the lady. You're the one who has a problem. You know, our brother, our son, our uncle, our cousin had other kids from the previous marriage. So then when they come in, look at it, you know, closely, they find out that it's the guy. It's the, you know, guy who had an issue. No sperms at all. The lady is, you know, all okay. So then you see, it's very mean to people in the society. They really need to have an understanding so that they can give such couples psychosocial support to understand that infertility is just a disability. It's only that can actually be treated because we have reproductive, or rather we have technologically proven ways of actually taking care of that condition. Yeah, and so to say, another reason as to why they keep on pinpointing on the lady is that, you see, socially, ladies are vocal. We are always all over. You know, ladies, we are in church, we are in social platforms. So you find out that these women, well, they are married. They are with the husband from time to time. But in a cultural, now the traditional way set up, it said that, well, whenever a couple, they are together, a man is the one who's supposed to go out for work very far. And so them meeting from time to time, you'd find out that probably this man, whenever they are having a meetup with the wife, it's when the wife is not ovulating. And you see, they have not yet even done any test to find out what is the problem. You find out that even both of these couple, none of them has any infertility issue. It's only that this work, you know, and they are only visiting each other, or they are having intercourse whenever they are not on the ovulation days. So they fail to do that.
Wow. And you're explaining it very well. I think with your examples as well, they are very relatable, and I'm sure people at home can relate as well. I'll want us to still talk on the issue of ovulation, but I'll want us to bring in later on a little bit. I'll just know where to bring it up. But on the issue, just on the causes of infertility, we have women as well as men probably, but let me just talk of women that are on different birth control methods. Let's say, for example, Ida has been on the Femiplan pills or has been on any form of birth control, whether long-term or short-term. But immediately I get out of this contraceptive method or birth control method, I'm unable to conceive, all right? So what period should I give myself immediately after getting out of a contraceptive method? What period should I give myself for me to now tell myself that it's not working? Probably I have an infertility issue.
Yeah, thank you so much for that question, and you've actually reminded me of more other points to bring on board. Yeah. So, well, contraception, we have two types of contraceptives.
Yeah.
We have the hormonal one and we have the non-hormonal one. Our bodies as ladies, we have hormones, both progesterone and estrogen, that helps us in these, fertility areas.
Yeah.
So then, when you are on a contraceptive, either hormonal or non-hormonal, our periods will probably be irregular, or some contraceptives will regularize the hormonal, concept in your body. So then, as Ida, as you said, you've been on these contraceptives for this long, and now you've decided to take off the contraceptive. But you're trying to conceive, you're not able to conceive. So then give yourself 3 months, because you see your body, the functions, the hormonal function within your body has been disrupted. So then we advise that you give yourself 6 weeks to 3 months. You try. If it fails, then you will have hormonal tests that you'll have to undergo. These hormonal tests range from AMH, that's a hormonal test. We have prolactin hormonal tests, so that they check how your hormones are functioning. From there, we can be in a position to advise the way forward. But basically, that one should not be a causative, like a factor to say that because I've been on contraceptions, then I'm having an infertility issue. Yes.
Right. Yeah. So it could actually be an issue that has not been brought forth even with the birth control. It's just an issue that probably you had.
Yeah, sure. Oh, yeah. Previously, probably you had your own, infertility issue, but it's not that it has been brought forth through the contraception. Yeah.
All right. Yes. You just mentioned that from my question, you had a number of issues.
Oh, yeah. You also stated about about the hormones now. I wanted to mention something about irregular periods. We have women outside here who have irregular periods. Probably maybe somebody coming in with the periods after 3 months. I've had a patient who has come forth with periods after 3 years. So you see, when you come all those 3 years, you've noticed that you've not had your periods for a good, period. That's 3 years. And
quite long.
Yeah, that's a quite long period for you. It's time for you to get checked, because for 3 years without periods, then it means, the ovulation triangle, or rather the ovulation lineage cannot be able to be traced, and so it can actually account to infertility on that angle. So irregular periods as well is an issue for ladies. Yeah. So if you find out if you find yourself that you're having irregular long periods of menses, or very short, it's something for you to come forth before it comes worse. Yeah.
So ladies should not actually wait for, 3 years, it's quite long.
Yeah, it's because of lack of awareness, and something, it's just, a normal thing. Another thing that should actually worry a lady when it comes to infertility, probably, at puberty, as I stated, we have something we call early comers and late comers. Early comers start the menses even as early as 9 years, as 11 years. If you reach 17 years and you haven't experienced any form of your periods, it's something that needs to be checked on.
Right. Thank you so much, Faith. I think we'll be taking a very short break, and when we come, we'll just be looking at probably, let me talk over treatment. We've looked at the issues to do with what infertility is, the causes of infertility, and according to our expert here, it's an issue of both men and women. So for members, or to the members of the society, infertility is not a women issue. It is both a men and women issue. And as Faith puts it, it's just a number of things that happen to our body. You should not actually just take them for granted. You should visit experts as far as infertility is concerned. So we'll take a very short break. We'll be right back in a few, definitely, with the solutions.
It's Christmas already here at CAC TV. Are you a business looking to advertise your brand and products to potential customers? Are you looking to improve your sales as we end the year? Starting this October till January 31st, 2023, we are offering you, our customer, various discounts up to 50% off our advertising rates. Imagine paying half the price to reach customers countrywide. Usiwache nyuma hii krisi. Call our sales teams now on 0738 278 506 or 0739 971 607. Contact us on email bnkogie@cactv.org or munyoroku@cactv.org for more information. Hurry and book now. Pamoja tuvuke mwaka. It's the CAC TV and your advert bonanza.
PCA Housing Cooperative Society Limited, a cooperative society under the Presbyterian Church of East Africa, brings you Baraka Gardens. Located 2.5 kilometers from Ardhi Shopping Center, 15 minutes from Thika Superhighway at the 40/80 serviced plots. It is a fast developing area strategically located at a central place for easy access to the capital city and Thika town. Nearby social amenities include a police station and primary school, water and electricity. The plots sell at 560,000 Kenyan shillings for PCA Housing Society members, 600,000 shillings for non-members. The prices are inclusive of the title deed fee. For more information, call 0708 145 222, 0708 145 222. Hurry and grab your plot now. Pay a deposit of 200,000 Kenyan shillings and the balance in 3 months. Baraka Gardens by PCA Housing Cooperative Society Limited.
PCEA Githunguri Presbytery invites you for the 2022 Rites of Passage sessions starting from the 5th to 16th of December at Githiga Children's Center. Charges for boys are 8,300 Kenya shillings for the sessions. An alternative rites of passage for girls will start from 12th to 16th December. The charges are 5,300 Kenya shillings. Some of the topics to be covered will be Bible study and Christian growth, communication and relationships, manhood, womanhood and adulthood, self-awareness and peer influence, adolescence and sexuality, drugs and substance abuse, among other impactful topics. Registration is ongoing at all PCEA parishes within Githunguri and at the Githunguri Presbytery office. For more information, get in touch with Githunguri Presbytery office through their number 0721 844 064, 0721 844 064. You can also get in touch with Reverend Samuel Gakuya, Mr. George Kagodho, and Reverend Lydia Kahiga.
Welcome back to CAC in the morning. We are definitely having quite a conversation this morning. We are looking at infertility, that is in both men and women. In the first part, which just in case you are not able to catch it, you can always go to our social media pages. That is Facebook and YouTube, that is CAC TV Kenya. So on this particular part, we are going to look at the treatment options for infertility. Remember, earlier on, we were just looking at the causes, and with the help of Faith Kemunto, she's just been able to explain to us of how infertility happens, what are some of the causes, that is both in men and women. And now, Faith, let us just look at the treatment options that is for infertility.
Yeah, well, thank you once again for that question. Currently, we have many treatment options, but I'll be in a position to speak to the two powerful ones, or they are the largest options that we have. We have IVF. IVF is what we call in vitro fertilization. For a couple that is unable to conceive naturally, they can actually have their baby through IVF. So IVF is basically whereby fertilization occurs in the lab, whereby we get in vitro means outside. Fertilization, now it's the fertilization itself, the meeting of the egg and the sperm. So in such a scenario, we extract an egg from the lady. It's a process that we do. Once we, the lady, we actually look at the lady on her day 2 of her period. When we do a transvaginal scan, so that we can check out how many follicles are there or within that ovulation period, within that period. And then after we extract the eggs, we get the sperms as well from the man. The sperm and the egg are actually, there's tests that are being done. They are mixed in the laboratory. After that has been done, an embryo is formed. Basically, when you're doing a natural conception, we start from the zygote and then the embryo and then the fetus. Now, when we're doing the in vitro fertilization, we have the embryo that has been formed now outside the uterus. Once this embryo has been formed, we do something we call a frozen embryo transfer. The embryo is frozen and then later on is transferred back to the uterus, and then the pregnancy is checked. Our IVF success rate currently at the center that I work at, it's at 56%. Yeah, and there's a way we derive that statistics, but that is a treatment option, IVF. Number 2, IUI.
Just before we go to IUI, now for the IVF, after fertilization has occurred outside, you now insert it to the woman now for her to carry the pregnancy normally. Yes,
we do a procedure. It's a process called frozen embryo transfer, FET, whereby that embryo has already been formed, right, within the lab. So once it has been formed, it's frozen, and then the lady is the embryo is transferred transvaginally. The lady is under anesthesia, and then it's transferred back to the uterus. We wait for 6 to 10 days, and then we do a blood test to see whether the implantation occurred or it did not occur. Yes.
All right. You can
that is IVF. Yeah.
Okay.
And then now we go to IUI. IUI is what we call intrauterine insemination. Maybe in normal language, whereby every other person can be in a position to understand, we know of AI, artificial insemination. So for human beings, it's called intrauterine insemination. This is a process whereby where we have a lady having blocked tubes, you understand, we have to do other, surgical procedures and any other thing. So for IUI, intrauterine insemination, we get the sperms. We get a spermicide, and then these sperms are injected to the lady's, fallopian tube, so that the egg can be, it's just directly injected to that egg, so that fertilization can take place now. That is what we call IUI. The difference between the two is the fact that for IVF, in vitro fertilization, both the man and the lady have to get their sample of the sperm and the egg fertilized outside and then later transferred. But for IUI, it's the man who gets the sperm so that they can be injected to the woman for fertilization to take place. Those are the major treatment areas that we look in.
Now, and for the success rate of the second one?
Okay, globally, IUI is low, but at our center, the IUI success rate stands at 27%. Yeah, but IVF is always high. It has a higher success rate as opposed to IUI. Yes.
All right. And probably the number of couples or women or men that are seeking this particular solution how is it? Is the number higher, or are people shying off from coming forth and just seeking this a solution?
Oh, well, yeah. 95% of the patients that walk to these fertility centers are always women. In the beginning, if you can recall, I stated that, you know, infertility is always perceived as a female issue. So the females are the ones who come forth for the testings and, you know, any other checkup, and thereafter the men come. It's very rare, you know, even on normal, you know, any condition when a man has, you know, feeling bad, it's rare for them to walk into a facility even to get medications. Yeah, but mostly it's the females who walk in, and thereafter they call their counterparts. But most of the cases, I always advise my, you know, patients to always come in as couples. As couples, so that they can both get checked. Yes, yeah.
And it's very key. I mean, when you're providing solutions, so that you're providing the solution not just for the lady, but for the man as well.
Exactly.
Let us now just look at, even as we wind up, on how to improve fertility. Whether I have been diagnosed to have an infertility issue or not. You've talked of we have these women that probably are unable to conceive for the first probably 3 months. How do I improve my fertility as a woman and as a man as well?
Okay, well, as I said, you know, infertility is a reproductive, you know, health system issue. So I would talk of a lifestyle mostly, because that is what at least you can be able to, you know, sharpen on. You eat healthy, balanced, you know, foods, especially the nuts. For both, because it has a mineral called selenium that boosts fertility, and we have even other supplements that can actually improve the fertility.
All right, thank you so much, Faith. And now you
something.
Sorry.
Yeah, I wanted to say something about freezing.
All right.
I would advise maybe ladies outside here who are busy in their careers, and they feel like they're not yet ready for their babies. It's good that you come forth. You can be in a position to freeze your eggs. We call it egg freezing. So that once you freeze your eggs, you can come for your eggs once you're ready, so that whenever you reach maybe at 35, 40 years, you do not go ahead and start using donor eggs. You can have your eggs frozen and later on use your own eggs, so that at least the gene of your baby can still be part of your genome.
And it's something happening in the country?
It's something happening. We actually advise ladies in their career, those ones who are busy in their careers, to freeze their eggs. Same to male counterparts. Our male counterparts, especially those who live very far away from their, you know, like in a scenario whereby, I'll give an example. Let's see that my husband probably stays in Kitale and I stay in Nairobi. We do not have a chances of meeting frequently. He can actually freeze his sperms from the other side, and then the sperms are, you know, transported to this place, and IUI is done to me. You never know. We have diseases that are coming, lifestyle diseases that come with time. We have people who have cancer before they go ahead to do their chemo, you know, and these other cancer and these other treatments. They can actually freeze their sperms, they can freeze their eggs, and then they use them later.
Wow.
Yes, it's done at our facility. Yeah, that is technology. So that you do not come suffering in, you know, in the near future. Look at our our brothers in the forces. Whenever they are going, or those ones in sports, you know, maybe they are gone outside to do sports. I don't know whether either you've come across, whenever they are doing like football or something like that, you see somebody even bending. Maybe they have been hurt and now they bend lower. You know, that pain, it's so real that you can even feel the pain on their behalf. So with time, that place becomes traumatized. The body sends something we call soldiers to defend that place. So those soldiers can cause blockage of those tubes. So it's good if you know you're in sports and such things can happen. You can freeze your sperms, so that whenever such a thing happens, you can still go back to get your sperms, and then you have your baby with, your gene. Yeah.
Wow, Faith,
Yeah,
you've
yeah.
explained so well. Thank you so much. And if I've understood, I'm sure my audience or our audience have understood as well. And now I'll give you an opportunity, probably, if someone wants to reach Faith, if someone wants to get this knowledge from you, or just to improve their fertility as a couple or as an individual as well, where can they get you?
Yeah, well, I'm based in Nairobi, Westlands. Clinic is called Myra IVF Center. We do all those fertility related, solutions. You can come forth and reach to us. My number, I can give out my number.
If you're okay.
If you're okay using my number, it's 0727 955 044. That's my number.
All right. Thank you
sure.
so much.
Thank you as well.
Faith,
Yeah.
Thank you so much for educating us, and just even as we continue creating awareness about infertility.
Yeah.
So I think that is where we end the conversation at. Remember, we were looking at infertility that is in both men and women. And if you're just joining us, remember you can always go back to our social media pages, that is Facebook and YouTube, CAC TV Kenya, to just get to learn together with us. So we'll take a very short break. As I mentioned earlier, today the world marks World Diabetes Day, and with the help of an educational video that is from Dr. Eric Njenga, a diabetologist at Aga Khan University Hospital, we'll just get to understand more about diabetes. So we take a very short break. We'll be right back with more.